Hello everybody. I was just trying to do a video about my stem cell that I recently got, which was yesterday. I got a stem cell therapy. I went to Dallas, Texas to go get it done, and you can still see that I have the little band-aids on my neck, and I have a whole bunch in my back. They did like 15 shots in my back with no numbing, and it's the second day after. I don't really feel much of a difference yet, but hopefully they said within the first couple days you might notice a change, and then maybe after 3 months you feel a change because the way the cells divide. But anyways, it's the first day after the stem cell therapy, where they take fat out of your body one place, and then they put it in a machine and they mix it up, and then they use those stem cells to regenerate your tissue. Because the main reason I have problems is because I have Ehlers-Danlos Syndrome. It's a connective tissue disease, and my tissues are deteriorating, and I have cervical instability. Hopefully not anymore. After this therapy is complete, I will no longer suffer from cervical instability or Ehlers-Danlos syndrome. I usually wear a neck brace almost every day, and even to sleep. It's a horrible way of life to live with Ehlers-Danlos syndrome. If you have it, you'd never know what kind of person you would change into. I was the person who got dressed up every day and looked nice, and I just changed into someone else that I never thought I would be in a million years. It took so much out of me, and it still does every day. So I'm hoping that the stem cell is working, and I believe that it is, and I have faith that it will heal me. For how long, I don't know, but any amount of time to be able to hold up your neck again, you'd be willing to give up anything to be able to put up your neck like you used to. Normally my neck hurts really bad, and I have to wear a neck brace most of the time. But more about the stem cell. They gave me 15 shots through my back with a needle, and I didn't have any numbing or anything. They just straight stuck a needle all over my back. Oh, it was very, very painful. Plus, they take fat off of your body and harvest it and spin it around in this machine, and then re-inject it in my back on the areas that were injured. And then they use an IV, and they put the other part of the stem cell through an IV through your arm. Right there, that's where they did it. And then they took the fat, well, they say the harvested area. It's from, can I see it? From that area right there. So they took the fat from that area and they injected it, well, they put it in that machine, and they sucked that harvested area out while I was awake. Oh my God. They gave me some lidocaine in the area, but since I'm an ultra rapid metabolizer, it's something that I have because I have EDS. And oh my God, you could feel him just in there just scraping your insides of your bone. I wish I was just asleep, but they didn't give me any pain medicine or anything. They only could give you tramadol, and oh my God, tramadol is like something that makes me nauseated and sick and throw up. Tramadol does not agree with me. I do not like tramadol. And anyways, they took me in a room, they sucked out the fat, they put it in a machine while you're awake, while they're just jabbing you, and some of the places he did hit me and I could feel it because it did not have any kind of numbing, and it was extremely painful. I don't ever want to get a stem cell again, but the results say that you could be better and you could regenerate your tissue. So I wasn't in the doctor's office trying to get anything else but my own regular tissues back, because EDS can have a life-changing experience on your life. And when you can't even hold up your neck, you basically need your neck for everything. So not having a neck, well, I didn't have really not a neck, but you know, I didn't have the ability to hold up my neck, my arms. And some days riding in a car is excruciating, and that is something that I never thought I would ever experience in my life. But I say this is the first day from the stem cell. I noticed driving home from Dallas to Houston, maybe 4 hours later, I started having like intense pain, but I didn't take the tramadol because I hate it. And so I took Tylenol, but it was hurting pretty bad, and I just came home and wanted to knock out. So we'll see tomorrow how my second day with the stem cell is, and I'll give you guys an update. If you have EDS, then you might want to try it. Have a good one.